Let's get to know more about menstruation. This is not only targeted for the women, but also for men who want to learn more about their partner, mother, sister, or any other woman in their lives. It is to understand why they are experiencing this, acting in this manner, and so on and so forth. So, menstruation typically begins between the ages of 10 and 16 or 2 years after the first signs of puberty and lasts until the age of 51 when a woman reaches menopause. So, the goal of learning more about menstruation is to know what to do, what to prepare for, what is normal, and when to visit the doctor. Let us now look at the definition of menstruation. Menstruation, also known as mens or period, is the vaginal bleeding that happens every month as part of a woman's monthly cycle. We all know that a woman is capable of conceiving a child. Thus, her body prepares itself for pregnancy every month. Imagine that. Your body expects a baby from you every month. Charot. If pregnancy does not occur, the uterine lining, which thickens in preparation for nursing a fertilized egg, sheds since you cannot be pregnant if your egg is not fertilized. Just because I have mentioned that period is a monthly vaginal bleeding, it doesn't mean it's all blood. Menstrual blood is made up of both blood and tissue, just like the blood clot that you see. That's perfectly normal. So these two, the blood and the tissue, flows from the uterus through the cervix and out of the body through the vagina. Why do women have period? Menstruation is a way for a woman's body to release the tissues that it no longer needs. The lining of a woman's uterus gets thicker as a preparation for nurturing a fertilized egg. And then, every month, of course, an egg is released and is ready to be fertilized and settle in the lining of your uterus. If the egg is not fertilized, if you are not pregnant, the body no longer requires the thicker uterine lining, which causes it to break down and be ejected, along with some blood from the vagina. After this, the cycle will then repeat itself. Your body will prepare for pregnancy, will expel blood again and again until you reach menopause.
Before a woman actually starts her period, her body and mind does a number of things to prepare itself. First, notice physical and mood changes about 1 to 2 weeks before period bleeding starts. Second, a woman might bloat, crave, have pimple breakout, sore breast, feeling tired, emotional unstable, headaches or migraines, cramps on belly, lower back or legs. Others experience premenstrual dysphoric disorder, which is a severe symptoms such as depression, trauma, and mood disorder. And 85% women more likely in the late 20s and mid-40s experience premenstrual syndrome or what we call PMS. So what is PMS and what causes it? PMS is when the hormones that control your menstrual cycle cause changes in your body and emotions around before or during your time period. The first cause is when the levels of estrogen and progesterone drop during the week before your period. Second, when the chemical changes in the brain, the neurotransmitter serotonin and norepinephrine have several important functions in the body, including helping regulate mood, emotions, and behavior. And lastly, a woman's lifestyle factor such as too many salty food, alcohol or caffeine, lack of sleep, smoking, and lack of regular physical activity. What to do when the symptoms arise? First, drink plenty of fluids to ease abdominal bloating. Second, eat a balanced diet that includes plenty of fruits, vegetables, and whole grains. Third, consider cutting back on sugar, salt, caffeine, and alcohol, especially if you're particularly sensitive to their effects. Fourth, aim to get 7 to 9 hours of sleep each night. Fifth, try to get at least half an hour of physical activity each day. Sixth, set aside time each day for self-care. And lastly, over-the-counter medications and treatments can also help by taking pain relievers like ibuprofen, aspirin, or acetaminophen for head and muscle aches or stomach cramping. Use diuretics to help relieve bloating and sore or tender breast, and use heat wraps or heating pads on your abdomen to relieve cramps. How about during menstruation? What happens and what to expect? The body's reproductive system undergoes changes beyond menses itself. The cycle typically follows a 28-day pattern with shifts in hormone levels, dysmenorrhea, and breast pain. On average, women are in the menstrual phase of their cycle for 3 to 7 days. A woman's menstrual cycle is divided into 4 phases. Menstrual phase is the first stage of the menstrual cycle. It is also when you get your period and may experience PMS. The second stage is called follicular phase, and it is when your body creates these small sacs that can mature into eggs. The follicular phase starts on the first day of your period, so there is some overlap with the menstrual phase, and it ends when you ovulate. It starts when the hypothalamus sends a signal to your pituitary gland to release follicle-stimulating hormone. Third is the ovulation phase. It is when a mature egg is released from the ovaries and travels to the uterus. And lastly, the luteal phase. After the follicle releases its egg, it changes into the corpus luteum. This structure releases hormones, mainly progesterone and some estrogen. If you do get pregnant, your body will produce human chorionic gonadotropin. This is the hormone pregnancy test detects. If you don't get pregnant, the corpus luteum will shrink away and be resolved. This leads to decreased levels of estrogen and progesterone, which causes the onset of your period. The uterine lining will shed during your period. And lastly, what happens to the body and mind after menstruation? Some might undergo post-menstrual syndrome, which symptoms will arise after a person's period ends. The post-menstrual condition is also associated with more intense psychological symptoms than PMS.
Do's and don'ts during menstruation. Do's. Take a bath and wash regularly. Bathing regularly during period is important as it removes the excess blood that could cause an infection. It can also help reduce menstrual cramps. Always be ready with a go-to kit. It is always beneficial to be ready beforehand with all the necessary supplies that you would require. Prepare brown ginger tea. A warm mug of ginger tea can improve certain symptoms of menstruation. Ginger has an anti-inflammatory effects which can soothe achy muscles. Drink a lot of water. Drinking a lot of water is always important, and this is especially true during your period. Staying hydrated can reduce your chances of getting dehydrated headaches, a common symptoms of menstruation.
Eat fruits and vegetables.
A menstruating woman should avoid having fast foods, fatty meals, dairy products, and fried foods.
Instead, she can have
Fruits, fruit juices, soaps, and lots of green leafy vegetable during period.
don'ts. Giving in to salt craving. Foods with a high
Salt content are not good for you when you're menstruating
because they can worsen.
and your cramps. What's more, it can cause severe bloating and add to discomfort.
Drinking a lot of coffee.
This is one of the worst things you can do when you're menstruating. High caffeine content can worsen
And your pain and also
contribute to breast tenderness.
wearing the same sanitary product.
All day long. It doesn't matter if you're using a sanitary pad or a tampon. Wearing the same product for more than 4 to 6 hours will prove to be breeding ground for bacteria and will lead to the development of bad odor.
Waxing or shaving. When you're on your period,
Avoid hair removal. The area is sensitive and the pull of the wax strips can hurt, adding to your discomfort.
in case you end up
With a cut due to shaving, it might lead
to infection. Smoking.
We all know smoking is dangerous for our health, but women who smoke during their period
Are more likely.
to experience severe pain.
Skipping meals. Skipping meals during the period isn't a good idea because
It can severely affect the energy level, making you feel lethargic and irritable. Avoid using cleansers with
artificial fragrance to
clean the vaginal part. Using cleansers during the menstruation cycle may irritate the vaginal part. During the menstruation cycle, it is recommended to use regular water to clean the vaginal part during periods.
avoid painkillers during periods. It is a harsh truth that cramps left us
Disturbed during periods.
many women can
Bear the pain and end up taking painkillers.
it will give you temporary relief during the menstruation cycle.
But it can harm your health.
Now that we're done with the do's and don'ts, we're going to talk about what's normal and not normal about menstruation. So we're gonna start off with what's normal. It is normal that menstrual flow might occur every 21 to 35 days and last 2 to 7 days. For the first few years after menstruation begins, long cycles are common. However, menstrual cycles tend to shorten and become more regular as you age. It is also normal for a blood loss during a period averages about 40 CCS or the equivalent of only 3 tablespoons. There will also come a time that our breasts may feel tender. There will be acne breakouts. We will be cramping in the lower abdomen and back. Mood swings. And bloating. And now that we're done with what's normal, let's talk about what's abnormal when experiencing menstruation. Periods that occur less than 21 days or more than 35 days apart are abnormal. Missing 3 or more periods in a row is also abnormal. Menstrual flow that is much heavier or lighter than usual. Periods that last longer than 7 days. Periods that are accompanied by pain, cramping, nausea, or vomiting. Bleeding or spotting that happens between periods after menopause or following sex. And lastly, amenorrhea, which pertains to the absence of period for 90 days.
Next is the facts and hoax about menstruations. These are the facts and hoaxes that our ancestors usually tell us to avoid unexpected pain or any menstrual symptoms. Girls that are menstruating can bath in cold water or wash their hair because of Ra'anmutin or the vaginal discharge that will go to the brain. Actually, it is very important to have proper hygiene. Wash our bodies and hair each day, especially during our period. When we bath and wash our hair, we feel more hygienic and confident. Water has no negative impact in our bodies, especially cold water. In fact, it can help clean our body and make us feel refreshed. Drinking cold water makes a period stop. Cold water has no impact on menstrual cycle. Menstruation is linked to the reproductive system, while drinking and eating is linked to the digestive system. Those two systems are separate. Therefore, there is no risk that a period will stop from eating any particular foods or drinking cold water. Factors that can make a period come late sometimes are being tired, stressed, or sick. Girls who are menstruating need to rest and can't do heavy activities. During menstruations, girls are as strong as usual and do not become weak. If they experience anemia, they can feel weak. But generally, girls need to be worried about carrying their everyday activities as usual. And also, exercises and physical activities provides other health benefits, such as improved mood, reduced menstrual cramps, and less fatigue. Although people may need to adjust their usual exercise routine while on their period, and staying active can be very helpful. Menstrual blood is dirty. During our cycle, our bodies get rid of blood and membrane that we no longer needed in our bodies. But menstrual blood is just like other blood from our body and it is not dirty. Period blood isn't rejected body fluids or the body's way of flushing out toxins. Think of it as evolved vaginal secretion. There's a little bit of blood, uterine tissue, mucous lining, and bacteria. Period blood is very different from blood that moves continuously through the veins. In fact, it is less concentrated blood and it has fewer blood cells than ordinary blood. When to see a doctor? You need to see a doctor if you don't have a monthly period or have more than one period per month, and when you suffer from the following: bleeding that requires more than one tampon or sanitary pad in an hour or for several hours in a row. If this happens, you might have menorrhagia, and a common amount of menstrual fluids loss per period is between 5 ml to 80 ml. Losing over 80 ml of menstrual fluid per period is considered heavy menstrual bleeding. Bleeding or spotting between periods. Vaginal bleeding between periods is not usually a cause for concern. If the blood flow is light, it is called spotting. Bleeding between periods can have a range of causes, including hormonal changes, injury, or an underlying health condition. But if the bleeding is heavy and persistent, please consult a doctor. Bleeding after having sex. The most common causes for vaginal bleeding after sex both start in the cervix. which is the narrow, tube-like end of your uterus that opens in the vagina. One of those causes is cervical inflammation or cervicitis. Although it is common to bleed after sex, it might cause infection. Severe pain. Primary dysmenorrhea occurs in people who experience pain before and during menstruation, a condition affecting the uterus or the other pelvic organs, such as the endometriosis or uterine fibroids, can cause this. Fever. Due to a rise in basal core body temperature during your menstrual cycle, low-grade fever during a period usually occurs, thanks to hormonal fluctuations. But consult a doctor if the fever won't subside. Abnormal discharge or color. See a doctor if vaginal discharge has an unusual smell or appearance, since every different appearance and color can mean something. Unexplained weight gain or loss. PMS can indirectly cause changes in your weight. Period-related weight gain is caused by hormonal fluctuation. It may be the result of water retention, overeating, sugar cravings, and skipping workouts due to cramps. Unusual hair growth or hirsutism. Hirsutism is stiff or dark body hair appearing on the body where women don't commonly have hair, primarily the face, chest, lower abdomen, inner thighs, and back. Also, polycystic ovary syndrome or PCOS is a condition which often begins with puberty, causes an imbalance of sex hormones. Over years, PCOS many results in excess hair growth, irregular periods, obesity, infertility, and sometimes multiple cysts on the ovaries. New onset of acne. It is very normal to have acne during period. One possible cause is the hormonal fluctuation that happen during the menstrual cycle. Hormonal shifts do all sort of things to a woman's skin. For one, the mid-cycle progesterone rises stimulates the production of sebum. Sebum is a thick, oily substance that acts as a natural skin lubricant. Sebum yields different effects in different women. For some, it produces healthy glow, or to others, it creates a chronic oil slick. The oil provides food for the bacteria. This bacterium causes increased breakouts and inflammations around the time of women's period.